Welcome, everyone, to another episode of Office Hours. I'm your host, Stuart Newsom, and today I have with me Bimal Sahoo, who's our Principal Product Manager here at Infinix. How's it going today, Bimal?
It's been a good sunny day here at Toronto, so it's been great, and it's always a pleasure to be in office hours.
Awesome, awesome. Yeah, we're very excited to have you. And I've never been to Toronto. I got to get up there at some point
You're
because
most welcome.
I hear it's definitely beautiful. So at some point that's on my bucket list for sure. I've been just about everywhere else, but not Toronto. Um, but yeah, excited that you are here for office hours. I'm always excited, it seems, about every single topic. I think everyone who's been in regular attendance to our episodes knows I say that just about every time that I'm very excited about today's topic, but particularly this topic regarding an aspect of denials management that is probably the pain of everyone who is in the denials management realm, whether it be with practice management and getting the billing done. And that is the aging of the AR. And as the title basically states, we're going to discuss smart strategies for aging AR today. Um, just a little background on that. I always like to kind of discuss some of the issues that we have and that we see out there. I'm sure Bimmel will agree. But there are certain things that plague the revenue cycle workflow because it's all about revenue cycle management. And certainly denials management is a huge part of the revenue cycle management process. You've heard me talk about revenue cycle encompasses a lot of different factors within that workflow. And certainly the aging of AR is one of the things that seems to plague everyone. First of all, it reduces cash flow. It ties up capital, if you will. And the reason I purposely use that term capital is because we're talking about business here. Healthcare is a business. Yes, certainly taking care of patients and patient care and being all clinical is top of mind. But if you're not making revenue, you're going to shut the doors, and you need that capital in order to deliver patient care. And that capital can otherwise be used for other expenses, particularly for growth. It also is a reduction in cash flow can strain financial resources and impact the overall financial health of the organization. This could lead to increased write-offs. As you all know, as accounts age, they become more challenging to collect. The older it gets, the more harder it is to get to collect. The more likelihood you're likely not going to see that revenue if you submitted the claim correctly the first time. So the longer an account remains unpaid, it's really that higher probability that it's eventually going to be written off as bad debt. And that typically is what happens. There's this black hole that I like to call write-offs that I'm sure everyone in the audience would agree with. It's also a high operational expense or cost, if you will. Managing these aged accounts requires a lot of resources and in follow-ups, collection efforts, a lot of time is involved. This increases operational costs and also, again, it diverts those resources from the critical activities needed in the revenue cycle in and of itself. So essentially, we're talking about time here for working those denials. If anyone ever knows me and has heard me speak before, I'm a big advocate of denial prevention. Is the best way to work a denial to prevent it from happening
Absolutely.
to begin with. And then also you want to determine those root causes. So you have to spend time investigating those errors. And it's all focused on prevention, I should say, and setting up those workflows to correct earlier on what's going on, if you can actually set up those parameters. But as we all know, that's not a reality in a lot of practices. So here you are with this great big pile of denials that's just adding up and adding up and adding up. And there's really no easy button. Maybe we're going to come close to an easy button today, Bimmel, right? So,
We'll try.
um, yeah, we'll try. But there's no real easy button. But the easiest thing to do is to do nothing. I see a lot of revenue cycle managers just kind of brush it under the carpet, so to speak. Let it sit there long enough and it'll eventually just go away, and it'll go away in light of being a write-off. So with that said, the deed is done. you've got this big pile of denials now, whether it's aging 60, 90, or even 120 days plus. Traditional processes just aren't cutting it. If they were, then it would be working. But we get into this perpetual workflow. And I'm sure, Bimal, you see this as well. There's this perpetual workflow where people are doing the same thing over. And that's the definition of insanity. You're expecting a different result doing the same thing over and
Could
over
not
again.
agree more. Could not
Yeah,
agree.
exactly. And so the technology is there. We've been talking about AI and automation. We just spoke about it last week, and we've spoken about it ad nauseum. It seems over the last couple of months, and it's actually all the buzz with machine learning, with automation, and all that stuff. But I think it's still kind of intimidating with a lot of people. The question really is, how do you get started? So there is an easier way. There is an easy button, so to speak, maybe multiple easy buttons to tackle this. So with that question lingering in the air, Bimal, just want to turn it over to you. Can you elaborate on what factors to consider when analyzing aged AR and how to automate the identification of such accounts?
Sure, Stuart. I think I would rather not take the easy way that you mentioned because it's just going to create more write-offs. There is absolutely more value in working the aged AR accounts. So I would rather suggest a slightly different way. There is always value even in older accounts that could turn into potential cash. So when it comes to aging, typically an age trial balance or an ATB report, it's the most commonly used report to analyze AR accounts. While it's pretty much simple to look at it and makes also a lot of sense uh, to look at all these aging buckets 0 to 30, 30 to 60 from a financial perspective. But there is a need for much granular analysis when it comes to operational aspects of working that aged AR, right? What are your true aged accounts and how do you go about working those aged AR accounts? So there's a lot of factors that you need to kind of consider. But to start off with, the timely limits or the filing limits or the appealing limits by each individual payer is a must to have. The billing status and the adjudication status of that particular claim are also some of the most important or critical parameters that needs to be analyzed to understand the true aging of the AR and what's collectible and what is not, right? When I mention some of these factors, what I mean is that you could have two different accounts belonging to two different payers. And even though they may have the same days of aging from a date of service perspective or data discharge perspective, one may be collectible, the other may not be, depending on whether they have across their timely limits as per the payer guidelines, right? Similarly, if you could also have one which is denied versus the other which is still unresponded, or you're waiting for adjudication status from the payer, then in that case, you may want to apply timely appeal limits in certain cases where you have denied rather than the filing limit, which everybody generally applies, right? To understand what's collectible. There are also more nuances when it comes to split bills or claim submissions, resubmissions, appeals, or in some cases like even specific denials like eligibility or registration, where you actually need to look at such encounters and such accounts very differently, right? So your bottom line is you need technology, you need analytics, you need these capabilities to automate the application of these rules to your AR accounts on a day-to-day basis. And unfortunately, most billing systems, practice management systems, they do not have those capabilities where you can have an operational view of your AR rather than from a financial view. Now, how do we kind of go about building one? Then I would suggest we start off with creating and maintaining the payer level references to the appeal and filing limits based from the provider guidelines repository. Then you should have capabilities to also build rules on top of it so as to address these billing, adjudication, and other scenarios that we just talked about. that will give you a much more operational view of your aged AR. Then you also need to kind of set up a pipeline that can automate the extraction of these detailed ATB reports out of your system or the accounts in a raw data form, and then funnel through these timely references and the rules we talked about. That will kind of give you a better picture of where you stand in terms of your aged AR. You could even have certain pairs like attorney claims, personal injury claims that have a long gestation period of getting paid, right? So you would want to understand your AR not from a financial perspective, but from an operational perspective first, so that you work it more efficiently. That will eventually reflect in your financial reports as well, right? This way, you would have much more better control, visibility, and you can drive your aged AR walk down strategies much better.
Awesome. Awesome. So, and you did mention efficiently. I can't agree more, looking at it from an operational perspective. Still, that sounds very daunting, when you consider how that, again, I'm going to reference them just as piles. They are just piles and piles of AR aging that's piling up out there. So we hear a lot of buzz about AI and machine learning and decision intelligence. Are there any applications in how this can help in aging AR?
Oh, wow. That's a great question, actually. I mean, there are a lot of applications that we see in terms of decision intelligence. It's more what we've seen is towards the patient access side, towards the front end, but there are equally compelling, opportunities and use cases for AI and machine learning when it comes to the backend, AR, aged AR work downs, right? So I can give you specific examples where we see a lot of value. It's about predicting the recoverability of your aged accounts. If you were to be able to predict what I'm going to recover from each of these aged AR accounts, then you can basically have a much more powerful insight into which account should I even work and what's not even worth the effort to go and work those, right?
Right.
You can use AI and machine learning to understand complexity of working a particular denial or complexity of working a particular case for belonging to a certain pair. You can also estimate what your number of touches would be to work those accounts. So commonly, I think there are quite a few interesting cases where AI and machine learning can truly deliver a lot of value in working aged AR.
Oh, awesome. So yeah, predicting AR recoverability, that's very interesting. If you can predict with a degree of accuracy, then that's a huge, huge advantage. Can you tell us more about it? Like, how do these models work and what factors should be considered?
Yeah, essentially, when you are trying to predict the recoverability of a claim, to be able to do that, you need to kind of be able to learn from historical reimbursement patterns and the payer behaviors. Uh, so, and this is where like machine learning models come handy because they can learn from past reimbursements, past data at scale. Uh, so rather than kind of relying on somebody's tacit knowledge or somebody's intuition to work on a certain account or the other, it would make much more sense to apply these machine learning models where they can just pick up very specific and granular levels of patterns which are not visible to regular human eyes, right? From the data, because they can consume all of this data at scale. Now, there are a lot of factors that actually go into building these models. So when we say about what are we trying to predict, so that's pretty much simple, right? So you're basically trying to predict your recoverability for a certain claim. So your output is kind of fairly kind of well defined, where you are trying to have this target variable where you want to kind of reach to a target measure, which is your the net predicted recovery amount that I want to collect on this particular claim, right?
Mhm.
But how would you go about building this model or train this model out, right? There are a lot of factors that go into building these models. But as a start, you can start including some of your primary predictive variables, including pairs to start off with, then locations or what geography, the allowed amount and or the contractual amount that for that particular claim is a very important variable. Patient demographics, of course. You also need to kind of include the different denials that have happened over the previous encounters and how their reimbursements have been. What CPTs, what diagnosis codes go into that particular claim. You could, I mean, when it comes to like acute care, you may also want to include different reimbursement models, BPCI models, around OPPS, APC models, uh, other bundled services models, including that, inpatients, including, you are having a recurring encounter, or is it like a emergency, outpatient. So there's a lot of variables that go into the things. You could also include, the length of stay when it comes to inpatient, the DRG codes that are relevant for that particular encounter, any other, discharge disposition, for example, could be
Mhm.
a key important factor, or from where the patient is kind of getting registered, that could also be a factor. There are a lot of things that actually go into the model, but depending on the business that you operate in, or the geography that you operate in, the specialties you are operating in, these factors could change from one organization to the other.
Mhm.
But
Correct.
essentially, it starts off with some of these basic parameters, as I mentioned earlier. And then from the, your claim information and your reimbursement information, your remittances, uh, you basically try to figure out which of these additional, parameters can bring in additional accuracy to the model without having to make it so complex that it doesn't work for certain cases.
Right, right. Totally agreeable. And that all speaks back to your first point of being operational focused, because
Yeah.
then you're setting up a good foundation, so to speak, for this machine learning. That's not just based on a financial element. So, and it's great, definitely to have the technologies to predict recoverability. But aging is an accumulation of tons of accounts that have not been paid. Again, it's going back to that pile that I keep talking about. But what strategies can organizations employ to prioritize those aged AR accounts? So you're predicting the recoverability, but then now you got to, well, which ones to go after first? How do we get started?
Sure. So just now we discussed about predicting the recoverability of an account. So which means essentially you may have a big pie, but you have sliced it out and said, okay, this for sure has never ever been paid in the past. And with very high degree of confidence from, as suggested by your machine learning model, it's telling you that you're not going to recover from it, right? So there is no point kind of working those claims out, right? So you basically from this entire part, you figured out this pie is not going to be collectible, and I'm left with the rest of my pie to chew upon. Now, after that, it actually becomes a little simpler because it then becomes an optimization problem, right? You have
Mhm.
very finite resources. And when you mean by finite resources, you mean you have a AR and denial management team consisting of, let's say, X number of agents. You also know what their daily productivity and their targets are, right? How many claims do they generally work on an average per day? So with that understanding, you have one constraint that you can work X multiplied by Y, which is their daily productivity, so many claims on a particular day, right? So that's your operational capacity on a day-to-day basis. Now, you also have certain other constraints that certain claims cannot be worked, uh, beyond their timely limits, because essentially there's no point kind of working those or prioritizing them in a way that they always fall onto the back and never get worked. So you're essentially losing your recoverability.
Mhm.
And then on the last one, you may have worked on a certain account, so you're waiting to follow up on it. So there is a cool off period. So that's another factor that goes in, right? So you have all of these constraints. And then your input is your daily inventory report. You've carved out what is not collectible. That's your input. This is your kind of constraints that you have to deal with. And the goals that you have to set for yourself is that how do I maximize the total recovery from this pie, which is collectible,
Mhm.
and also ensure that all the high collectible accounts, right, where you would have a predicted recovery showing you it's in a tens of thousands of dollars that are getting prioritized over something which is, let's say, $100 or $200. And doing all of these, you have to add another constraint now, that at the same time, none of these accounts should cross their timely limits. So as I mentioned before, if you take you set a goal, you set your constraints, and you applied certain rules, combining this then becomes a optimization problem. And there are absolutely mathematical models which can solve this. Now, if you
Right.
don't have technologies, I mean, it could get sophisticated as you kind of build it. But if you don't have the capabilities, at least there are some crude ways to at least go about it, which is about, hey, go with the high dollar recoverable accounts, but also you have a parallel way of prioritizing anything that's going to be non-recoverable because of timely limits in the next 4 days, 5 days. So you can have a juggle between these two lists, but I would definitely recommend spending effort building out these optimization models, because they give a fantastic output in what accounts should be worked and when, because all of these eventually leads to cash or additional cash, which
Mhm.
providers were not seeing in their books earlier, but suddenly they are now seeing this because there is a machine learning model and an optimization model which is kind of driving the set of accounts that need to be prioritized.
Right. So now you've built kind of these workflows, but then it becomes its own machine or its own animal, if you will. It's actually working. If you work the process, it's all about working the process.
And
And
the beauty of
yep.
it actually is that these machines, these models never sleep. So you're
Yeah,
not dependent on humans. You're not dependent on their intuition, on their tacit knowledge, their tribal knowledge. You're actually going by data and science, and what's reflective of your reimbursement and potential, right? So I think that's the best way to go about in
right.
today's.
Yeah, that's fascinating. Absolutely fascinating. Well, in speaking about the predictability and prioritization, are there other items or technologies, if you will, especially around automation that can help with aged AR recovery? And if so, what are some suggestions to organizations to go about implementing those?
Sure. Um, I don't think there is a very specific application or automation that you would have to do for HDR accounts. I think you can use the same set of automation capabilities if you have, or maybe you want to kind of partner with a vendor who can bring those capabilities to you. And they typically are all about claim status checks or doing some adjustments, rules built into your practice management systems, or have a third party workflow solution which can orchestrate different cases out. So these are some of these, but I'll go into more details. So where I see a very specific or a handy outcome of an app, of an automation would perhaps be the claim status check.
Hmm.
Right. So when it comes to ASDR, it's always a mixed bag of having denials posted against certain records, whereas you are not having adjudication status or the latest adjudication status on that claim. So you basically are blind, right? You submitted the pair, it's like 90 days old, 120 days old. Maybe you have resubmitted it, but you don't have any status on that particular claim. So you don't know what to do with it. And typically in your regular workflow, you would have to kind of call the pair and get that information from them. But what if you have automated the claim status check on aged accounts? So you have certain thresholds and rules, and you say, okay, for these sort of claims, before my agents and collectors are coming to work, can I fetch the latest status of these claims?
Mhm.
So that takes away half of the burden from the agent, right? So he doesn't, or he or she doesn't have to spend as much time in working that claim because half of that work is already done. And when it comes to that, your output of the claim status check could be some of these scenarios, right? It's the claim is not yet on file. I mean, we trusted as if we submitted the claim and it has reached to the payer, but it is not on file with the payer. So at that
Mm.
point in time, they could take the corrective action of doing a resubmission or follow up with the payer or ensure like where it is stuck in the cycle
Mhm.
of reaching out to the payer. So that could be one scenario. The second could be your adjudication system, right? It's stuck with the adjudication system of the payer and they're taking a well over like 30, 40, 60 days to even reply back. So in that case, maybe you may want to give some more time, or you may have a strategy defined where you would call the payer out and figure that out over a phone call or from chat websites, chatting with the payer. The other could be you may have actually the payments which have been in process, but somehow these checks are lost or they've not been posted into your system. So that's why you're seeing a lot of aged AR, whereas it has been already adjudicated by the payer. And God forbid, if they're not denials, they have not lost their timely limit. So you can actually post this um, uh, payments into your system and get rid of your aged AR. So it depends, like the different scenarios or outcomes that would come out of your claim status check. But I would definitely recommend integrating with your existing, clearinghouse solutions if you have any, or work with a more comprehensive claim status check partner like Infinix,
Mhm.
who can work with multiple different payers out and different clearing houses, payer portals, automations, build robotic automation capabilities that can take this burden of claim status response retrieval from the payers for your agent. So that typically just makes it half. Your effort and time for the agent to work that account just becomes half. So that's one to get one way to kind of get started off with, right?
Right.
The second could be actually using a sophisticated third-party workflow solution and a workforce management solution, I would say. The reason behind that is what we have seen is most billing and enterprise solutions, the practice management solutions, they do not actually are the best in actuating the operational workflows. They would have like a few degrees of variability that you can configure in their
Mhm.
accounts, where you could say, okay, I want to create a work list based on certain aging bucket or for certain pair. But you can't go much more granular in taking all the status of the particular claim into account, their denial status, their when was it last denied, how many days have passed since when I last worked on it. So all of these complexities cannot be orchestrated. Now, if you have a whole lot of aged AR accounts and you're big enough, you should definitely be investing in a workflow and a workforce management solution to orchestrate this way better. Uh, then you could also use the same level of things around automating the appeals. Um, but I would say it's going to be a little difficult journey to get started off with, but not the one that you just turn on today and can see the results out. It will take a longer gestation period. So I would rather suggest you go ahead with the claim status check automation as a first step, as one of your automation initiatives to kind of start off with, followed by perhaps actually insurance discovery and eligibility checks. So you may have a lot of denials sitting in your aged accounts, uh, which have been denied for registration denials or eligibility. In that case, it would make more sense to do an insurance discovery at that point in time and get it out to the correct pair as soon as possible. Because if you are staying and waiting on top of it, and for commercial payers, generally their timely limits are 90 days, 120 days. So if you are older than that, you are losing a lot of money by not sending it to the right pair. So these
Yes,
are
you
some
are.
of the things I would definitely recommend to kind of invest in because they definitely move the needle a lot.
Right, right. And you really alluded to this, but taking baby steps. You don't have to solve everything at once, but I think claim status is a huge lift. That simple task, and it's not simple. I don't want to, underemphasize the effort that it takes from a manual perspective. But if you could have that automated and ready, available to you, and then going into those workflow managements and where you're assigning which denials can be worked in certain queues, that's a huge advantage. And there are other things and other applications, but I think to the point is, take baby steps. You're not going to, eat the elephant all in one day, so to speak. You just one bite at a time. So, as the old adage goes. So we've discussed a lot of great solutions, really, to address the aging AR. What impact and uplift have you seen in organizations adopting these technologies or these methods?
Yeah, I mean, we have a bunch of clients in Infinix who use these solutions that I just mentioned about. And we've seen at least a 15 to 20% improvement in their net collections from working AR and denials in particular. And definitely from aged AR, because that's where the machine learning really shines in telling you, do not work on this, work on this, because this is where you're going to get the most bang for your buck, right? And you also, from the other perspective, you also want to kind of keep a check on your cost of collection. There's no point working on a $10 claim where your effort to recover that claim is $15, let's say. So keeping that in check, I think it's most important for you to be focused on using some of these technologies, and we have seen absolutely great results in terms of 15 to 20% improvement in your AR and denial collections. We have seen close to 20 to 30% reduction in your days in AR or aged AR over 90 and 120 days. And then using some of these automation capabilities also kind of reduce your cost to collect, because half of the work is being done by the machines, which operate at a fraction of a cost, which uh, do the work 24x7, not dependent on certain humans to be involved in the process unless until required.
Mhm.
So definitely, I think we see the bottom line kind of also improve because of implementing these solutions, because you're getting more money and at a lesser cost. So it's a win-win on both sides.
Yeah, that's awesome. And definitely you can also use this information, as I had mentioned earlier, when we first started this episode, was that denials prevention concept. Because you're spending money chasing money that you should have got it paid for the first time. So don't wash and repeat, but take these lessons learned. Because I can see how it's hard to measure that, so to speak, as to what it's actually really costing you. And a lot of practices have no clue how much it's costing them. But this untangible impact that you are saving in resources and human capital in these processes. So that's awesome. So we're actually going to at the end of the actual interview that we have with Bimal. I'd like to open it up for Q&A. I always forget, Bimal, at the beginning to tell people to enter their questions as we move along. But I do want to invite everyone to at least enter some questions in the Q&A. And we do, and some are just intuitive. They already know, hey, let's put in, I got a question. So here's one question that I'd like to float out there that we've got in is, how do you measure the success on aged AR recovery, and how can you continuously improve on it? Sorry, I was just kind of reading that wrong. Yeah, so how can you continuously improve on it?
Yeah, so from a financial perspective, you're going to look at your aging metrics, which are typically your days in AR over 90 and 120, and see some of these technologies, how they move the needle on those aspects. It's not going to come overnight. It's going to take some time because it's dependent on the payer's adjudication cycle. So give yourself around 30 to 60 days to see that value, and then kind of optimize on those regards. You may want to tinker your workflows in which perhaps you may not be wanting to appeal those claims out. Instead, you may have to resubmit the claims or rebill it. So some of these things that you have to kind of take out, see where you are seeing success, right? Uh, what actions are giving you the success that you need, and you can typically measure that. Starting your 30 days by looking at your denial overturns, your success of your appeals or success of your resubmissions. What works for certain payers may not work for others in certain cases. So you have to be very specific into kind of monitoring those things out, and also keep a tab on your payment lags. As you are working through these certain accounts, you may realize that there are certain payers who are taking more time than the others. And if you kind of understand how much typically as their average days to get reimbursed by each individual payer categories, or at least on the top and the broader ones, at least, then you know when to actually follow up on it next or when to touch it. There's no point touching it sooner because then you are incurring cost of working that. And there is no point touching it later because then you are getting delayed for the payments that you are owed to.
Awesome. Awesome. Well, I think that's going to wrap things up for us today. Bimal, very excited that you were here with us today. We're actually going to have more of you. We're looking at next week as a part 2 to this, where we'll actually perform a demo of everything that Bimal's been talking about. So you can see this in action. So I encourage you to join us next week for the episode of Office Hours on the 27th of June. Is what we're shooting for this. Things do change. You never know when something's going to happen in healthcare that we can have another episode. But our plan is to put all this in action for you and show it to you more or less, and how you can apply it within your situation. How's that sound, Bimal?
Yeah, absolutely. Excited for
Awesome.
that.
Well, appreciate everyone joining us today. And as always, you can always contact us through our website at infinix.com. Look forward to answering any questions. If you didn't get a chance to ask a question here, please contact us and we'll be happy to answer your questions and all your questions and speak to you more about everything that Bimal talked about today with automation, with your aging of your AR. So thank you everyone for joining us, and we'll see you next week.
Thank you.